In this video, we're going to talk about deep suctioning a patient who has been endotracheally intubated. So if you're working with an ACP, then you will be allowed to deep suction a patient who has been intubated if the ACP requests. And there's a couple of things you want to consider when doing so. So the first is that whenever we're going to deep suction, we want to make sure the patient has been properly pre-oxygenated. So this typically means 1 good minute of ventilations, ensuring that we have an oxygen saturation probe as well as our end tidal CO2 on the patient prior to starting our deep suction attempt. So we'll give adequate pre-oxygenation of the patient, making sure we're giving the lungs lots of tidal volume in reserve for when we actually start to do our suction attempt. In order to do deep suction, what you will do is we'll take the endotracheal tube or the BVM off the endotracheal tube. We grab a deep suction catheter, so it usually looks something like this. It is a closed catheter, so it has a sheath around it to prevent basically something from the external environment from getting into the patient. You're going to want to inspect, make sure that it's not expired, and then you can apply it to the endotracheal tube. So here you can see we have a T adapter. We're basically going to move in perpendicular to the tube, so directly onto the tube, and then your BVM goes onto the elbow here. So we've got the BVM attached to the elbow, and we have our suction catheter now attached to the endotracheal tube. Your deep suction catheter will get attached to your suction unit, so you'll attach it to your suction unit, and you'll suction it. You'll be turning that suction on to the pressures that have been set for different patient ages. So when we're looking at a child, we're going to be suctioning that patient at 100 to 120, an infant at 60 to 100, or an adult at 100 to 150. So when we're going to suction, what it looks like is this. So when you're going to deep suction the patient, we are going to insert the suction catheter. So we pinch the catheter within its sheath. We're going to push it down into the endotracheal tube until we meet resistance. Once we meet resistance, what we're going to do is engage the suction. So I can push this button here. Some suctions have a lever on them, but this one has a button. So I'm pushing down the button and I'm pulling out the suction catheter. Around 10 seconds what I'm looking for. Typically pulling the suction catheter out using a twisting motion. So you can see I'm kind of twisting the suction catheter as I'm pulling it out. Allows us to make sure that we're covering the circumference of the endotracheal tube as we're doing so. So I'm suctioning for no longer than 10 seconds, and after every suction attempt, again, I want to re-oxygenate the patient. So typically I'll ventilate for another full minute to re-oxygenate the patient prior to doing another suction attempt. So say a minute of ventilations have passed, again, I can insert the suction catheter into the patient's endotracheal tube and down into the trachea. I'm going to stop when I meet resistance, or if we're suctioning something like a tracheostomy, the patient will cough. I'm going to engage the suction catheter and pull out over the course of 10 seconds while turning the catheter within the endotracheal tube. And that's all there is to it. So this can stay on the patient, and we can actually ventilate because again, this is a T adapter here. So we continue to ventilate the patient. There is no maximum of suction attempts, so you can suction as many times as you need to, remembering that we need to make sure that we're prioritizing oxygenation of this patient.